Welcome to the Talking HealthTech podcast. My name is Peter Birch. I'm here at Digital Health Week, hosted by HiNZ 2024, and I'm at the Five Faces booth, and I'm joined by Phil Baskerville, Digital Project Director for New Dunedin Hospital, Dan Owen, Director of Health at NTT Data, and Rachel Wolfe, Chief Customer Officer at Five Faces. G'day team, how are we going?
Great, thank you.
Good. It's great to be here, and keen to learn about why we've all joined at the booth and unpack that a little bit more, because I think it's a great example of providers coming together of technology solutions to really solve some problems. But I think, to set the context, it'd be great to start with you, Phil, and give us a bit of an overview of the topic of focus here, which is at the New Dunedin Hospital and the outpatient side of things, what that's all about and the why, and we can start it from there.
Cool, awesome. Hey, great to be here, and I'm glad you guys got a good welcome yesterday, and like good traditional Māori welcome to Aotearoa. So it was, I saw you having a good time there. So yeah, excellent. Really, I think this is the first outpatients building that'll be commissioned by HealthNZ. And with the sort of the health reforms and what HealthNZ's trying to do from now on, it's about building repeatable platforms, or building a platform that can be repeated really easily, not having to redesign each time. There's a big deficit of hospital builds. There's a long program that the HealthNZ's built out with all the digital facilities that need to be done over the next decade. So it's about getting a repeatable pattern established, and the outpatients is the first building that's going to do that. So just kind of it's aligning everything, making sure we're operating as one health system, and really doing things once, doing things really well. So the next time it gets easier and easier, and it becomes a paid by numbers approach in the future. We're not there at the moment, but it's about working out. Okay, we've got all the layers of a modern hospital.
Yeah.
And just making sure that the layers just stack on top of each other, and we get them built properly, and back into it.
I like it. And so give me a idea of the scale or the level of services, or like what the outpatient building is.
Yeah, it's 15,000 square meters, which you think, what does that mean? It's a lot of houses. There's 10,000 square meters of clinical floor space.
Okay.
And I think that's like a hectare of land. I'm not sure if anyone's been to like a lifestyle block or that's a lot of space, and that's clinical space. And then there's another, So it's a lot of building, but it's doing a lot of work. It's a building that's going to be moving constantly throughout the day. So it's not somewhere where people overnight. It's an outpatients building. So people, the medical term is ambulatory.
Yep.
Which basically means you walk in and you walk out. So it's not an overnight. You don't get checked in. You don't get admitted to the building. So therefore, it sort of opens up, wakes up in the morning with sun.
Yeah.
Or it depends what time of year it is, to be honest. But yeah. So basically, it's a day building. So we've got lots of clinics. So we've got 2.5 floors of clinical space, and so that's about coming in for either a 15-minute, 20-minute appointment with a specialist. Or it's one of the more, I suppose, multi-step processes where it might come in for some radiology for a scan, then you go upstairs for an orthopedic sort of check-in, and then you might finish up with some physio, but making sure you've got that path through the hospital sort of mapped and known, and everyone's aware of what's going on, because I think that's very much that sort of that simple pathway, or that one appointment, one and done. Or it's that multi-step, and it's making sure all the services are coordinated across all of those, because they are currently coordinated, but it just takes a lot of work ensuring that they're coordinated. So it's just really making that sort of investment in digital infrastructure so that we can move people throughout the building really quickly, get people into the building on time as well, get them in on time so they don't have to spend all day, and then get them out so we respect not only the clinician's time and the staff's time, but also the patient and whānau's time as well. So it's really about being as efficient and productive as possible.
Yeah, I like that. I picture my own healthcare experience back home in a I guess, an outpatient facility, a super clinic. But in my area, it kind of feels like I'm walking into a shopping centre where, if you go to the shopping centre, the grocery store's not going to know what you bought at the shoe store or all that kind of stuff. Nor really do they need to know. But I guess in that healthcare setting, you'd want to have that kind of visibility through the level of care. So you've already started to unpack some of those problems to solve. But like, what are the key kind of things you want to make sure are addressed? Particularly, I imagine technology is going to play a really important role in that.
Yeah, and I think it's in a modern building you'll have good Wi-Fi, and the point of the building is that we've kind of, with the help of our technology partners, as we've flooded the building with Wi-Fi, so we've got location grade Wi-Fi, so we know where equipment is, because that's one of the big things that could really hold up an appointment.
Yes,
as if you're looking for that. I don't know. I'm not going to even try because I'm not a medic, but yeah, it's some sort of fancy device that you can see all around here.
Yeah.
Today. And you don't know where that is, and it's stopping that clinic from progressing. It's just all that sort of stuff. So just knowing where gear is, making sure that those appointments run to really good time, and also that people are connected as well, so that you can use your phone, whether it's your mobile network operator or whichever telco you're using, making sure they can all get in there as part of what's one of the things we're doing.
Yep.
And it's really a sort of actually how do we make the building work for all users of it, not just one.
Yep. No, that makes sense. I'd love to it sounds like it's not a problem to solve that's just relevant to Dunedin. This is something that, we've got some technology providers here that are doing these kinds of services, I guess, across the world. Dan, from your perspective, I'd love to learn a little bit more about, what this approach to having this interconnected care through technology is, it looks like in other parts of the world too.
Yeah, no, great question, and it's something that we do see globally. So NTT Data, we've got a health vertical in every region, in every country, and we do a lot of work with hospitals and care facilities. And part of the reason we were chosen as the digital infrastructure delivery partner for this hospital was that, they were experienced from Australian hospitals and the likes, and bringing together the partners and the ecosystem to deliver that technology. And because of that, I guess that status, we do see a lot of trends around the world. And smart hospitals, smart campuses, smart hospitals, that is a trend that's happening right now. And you think, okay, smart hospitals, is that things like IoT and trackers and everything else? Well, not really. It's more around what's smart in the hospital that's actually increasing the patient experience, giving a great digital experience to patients and clinicians alike as well. Nobody really wants nobody sets out to create a poor experience for anybody.
Yeah.
So we just use technology as best we can to create, that great digital experience. In terms of what's happening around the world as well, hospitals is definitely where it's at. So we've recently released a report that says that in IT spending in the healthcare industry globally, about 57% of it is going on to hospitals at the moment. So it's where the spending's at. It's exactly the right time for Dunedin and for New Zealand to be invested in this area, because the modifications, the newer innovations are there to be taken advantage of. And it is all about this approach of bringing together your core infrastructure, as you said, Wi-Fi and networks, and then building upon that to be able to put something in like Five Faces digital front door as well, create that experience, to create, great experience, but also to, as Phil said, reducing time to serve as well. So reducing costs, reducing time to serve, seeing more patients, really getting the back some benefits out of the hospital that you're building. So yeah, it's completely on track with what we're seeing around the world.
No, that's good. It's interesting to know. You touched on a few times the importance of providing a good experience to patients. I'd love to learn from you, Phil. What does that look like? Like, what is the expectation of patients when we say to have a better experience, and maybe how that's changed over time too?
I could probably fill up about 3 or 4 podcasts with what we did during the pandemic, but I'll spare you from that. But what the New Zealand sort of did through that was the people at the end expected digital services, which is fair enough, because it was, you expect modern thing services in healthcare. So things like an SMS or text message to say, hey, we're expecting to see you, or some sort of record that follows you around, or the ability to choose your own appointment, like all those things that we did through the pandemic, through the vaccine and all the sort of the COVID response, is how do we then pick up that expectation and honour that,
yes,
and keep going. We don't retreat from that position. It's how do we leverage that and look around the world and what can we imitate? Like, we don't need to build these things from scratch. And what can we say, right, this is what we're trying to achieve. How do we do that? And really get the digital foundations we've got. We've got really good identity. Everyone in the country generally has what we call a My Help account, which is essentially a credential that you can log in and is tied to your national health number. And so just something as simple as that, like, wasn't there before the pandemic.
Yeah.
And really doubling down and reusing those technologies in the new world and moving forward, I think that's why I get up in the morning.
Yeah, nice one.
Is to push these things forward. So
yeah. And that makes sense. And, as you suggested, through COVID, we saw a lot of new ways to engage with the healthcare system. We want to hold on to some of those good bits, but also as patients experience service in different industries, then, you kind of expect that your healthcare will provide similar things. You need the technology to be able to do it. It's easy to say, but you need to be able to implement it and have it all tie in. And that's where I guess the technology comes in. Rachel, from your side, how are you kind of leveraging technology and then applying it in a care setting like an outpatient facility to be able to meet some of these expectations?
Yeah, so I think it's really interesting that you touched on the COVID experience. I think patients are consumers and they are looking more to engage with healthcare as they do their banking, retail, everything. And we proved some of those misconceptions or perceptions wrong, that older patients or patients with different levels of literacy and ability won't engage with technology, but it can actually support them. So it's interesting to implement this in an outpatient setting and I guess prove some of those misconceptions wrong, work through, make sure that the solution supports all patients and visitors, not just patients who might be like us and really love digital and look towards that digital engagement.
Yes.
Yeah, so I think what Dunedin are doing is really quite progressive and probably, leading the way.
Yeah.
And leading the pack.
Nice.
Yeah.
It's one thing to have the interfaces and the engagement with the patients or consumers to be able to interact with a clinic in a digital setting, but you need that infrastructure underneath and the core capability there to be able to do that. Talk me through, Dan, a little bit more about what exists there in terms of the infrastructure to enable some of this capability that's got to exist in the outpatient facility in Dunedin.
Yeah, I mean, it's everything you could imagine you need to run a company from an IT upwards, really. You need cables and wires and you need an internet there. You need compute and storage, so that's all gone in there. And a lot of that is either refreshed from existing or it's brand new because we've got some new requirements that need that stuff. And, that's often the bread and butter kind of stuff you need, but it is the important factors that everything else is built upon. Once you've got that, then we can start, putting in the integrations. So, systems like Five Faces, other clinical systems, and then building the APIs and integration, the coding there as well. We've got another partner that's solely focused on message integration as well. So you kind of look at the full stack of technology from the ground upwards. Wi-Fi, and then once you've got those in place, you can then start having conversations further down the field of, private 5G and the like and everything else as well. So it really is kind of everything you just imagine that you need for a business to run. Laptops, printers, that IT as well, but down to the trolleys, the mobility trolleys and the brackets and the arms and a lot of things that you may take for granted, but that actually takes a huge amount of planning to get those working. And actually, the advancements that are made in simply accessing mobilities and trolleys and things like that, we're seeing some good advancements in technology in this project alone since it's been running on things that you think are simple and just work. And that's happening at that kind of basic foundational level. So what's happening above that is really fascinating as well.
There's usually a fair bit of work in making those things that just work and you don't even notice. I guess then you've done a good thing because no one's going to write a 5-star review on the fact that, the internet worked or something like that. But there's the expectation that it's...
Well, it is, and it goes back to what Phil said. You expect in this day and age, you expect your text messaging to work. You expect to be able to use the internet where you go. And if you turn up to a hotel and there's no Wi-Fi there or anything, you feel like you've gone to the dark ages, right? So you need that to just to give what I would call just a basic human experience right now in a facility like a hospital. So yeah, it all has to work seamlessly as well, because let's face it, something goes wrong, everyone's going to blame the Wi-Fi to start with. It's always a network's problem when things go wrong. So we don't want it to be that. So we take the care and attention to make sure the foundations are there, as you would when you're building a house or building a brand new outpatients building. And then it lets us to the really cool stuff on top.
Yeah, no, you need that ticket to play and everything else on top of that. I imagine too, Phil, in building these digital pathways for a community, you need to build to ensure you're not leaving anyone behind. So I imagine that cultural narrative is going to be really important to weave into it too. I'd love to hear a little bit more about how you've thought about that in this digital pathway.
Yeah, being a physical place in Outpatient Dunedin, there's a definite cultural element to the site. The site of the building is on the wet feet of the lagoon. That was the original when Europeans arrived. So it's got quite a bit of cultural significance. And in that, through our By Faces partner, we're actually having the local dialect incorporated into the tool. So when you present, we're presented with Kaitahi's local dialect.
Yes.
And also Te Reo as well as another option, but it's that it's the acknowledgement that we're in a physical location, and it's going to be a beautiful building.
Yeah.
But also there's a responsibility there, public infrastructure and all that sort of side of things of making sure it's a good building that lasts the test of time. So yeah.
No, that's great to hear.
And we'll also, I think, bringing that into the digital program as a whole, because it's not something you do afterwards. It's something you've got to weave into the fabric of the building as well. So I've just been to the diversity and inclusion workshop here, and one of the take-home messages from that was you build for the 20% so that it works for 100%. Yeah, and it was a really nice notion, because it reminds me of the work we've done all the way through. Is you've got to make sure that it's accessible, that whether you've got a screen reader or whether you've got vision challenges or whatever the challenge that you've got, that we can cater for that and make sure if it works for the 20%, it'll work for everyone. So that was a really nice take-home message. It sort of reinforces, like, it's not like new, but it's always really nice to have that stuff reinforced. Yeah, that the habits we've got, we're on the right track. And so it's about implementing and just making sure that, reminding us that we've got that. And yeah, I think it's just a really important thing to remind yourself that it's not just ours. It'll be here for a long time. So yeah, it's done right and done properly.
No, I like that. And I guess if you've got a new build, you've got the opportunity to build something from scratch that's relevant in our current climate, and in terms of is representative and accessible for everyone. And the last thing you'll want to do is kind of have something that looks like it's tacked on or at the end to tick a box, and it doesn't sound like that's the case at all. So that is great. It sounds like you're on a bit of a journey now, and there's been a lot of progress, and there's a lot more to do. I guess where are you at now with the project, and what's to come in the next, say, 6 months?
Right now, we're in the middle of commissioning our design lab. Yes. So this is a building across the road from the outpatients building, where every single piece of tech that's going into the outpatients building goes through that particular setup. So we've got a kiosk in there. We're pressing the buttons furiously. But we've got the Wi-Fi in there. We've got the networking. We've got the devices. So as you said, like, it's that sort of 3D touching of all the tech that's going to go in there. Will be a really fast way of prototyping how the building's going to operate for all users. So it'll be an environment where we can bring clinicians, administrative staff, members of public, some med students who end up using it. Like it turns into a space where people can come in and experience what the building's going to be beforehand. And yeah, just taking that feedback in and making sure that when the building opens, we're comfortable and confident that we've done that it's going to meet the needs of the community.
Yeah.
So right now we're literally, I think NTT are burning some midnight oil around Australasia at the moment. Just making sure that we're working on all that sort of the networking, all the facility systems are getting installed.
Yeah.
The layers. I've got to talk tomorrow, but all the layers that are going into the building get in there, and we can start prototyping and getting some really quick early feedback and building confidence in the products that have been selected, and then clinicians can start coming and pressing buttons, giving feedback, and we can make it better.
Yeah, amazing. Well, I think it's a great opportunity to, or a great example for, I guess, the ecosystem to reflect on, because the ability to build something from scratch that is pulling in different providers and really addressing a need is super important. It's often a challenge that involves collaboration and partnership, so it's a great example of that. I'd love it, from each of you. Perhaps we'll start with Dan and move down. To close out, any kind of either reflections on good lessons for others that might be looking to do something similar, or ways to collaborate with partners to really deliver strong outcomes for communities. I guess reflections from the process so far and moving ahead that might be valuable to the ecosystem.
Yeah, look, I mean, as we see here today, the project's going fantastically well, it's safe to say. My reflections on that has just been the collaboration, communication between all parties involved. From the outset, it was a partnership in terms of design, delivery, choices that have been made, bringing together, as you said, bringing best of breed partners that we've worked with before as well. So, although it's a new hospital and there's new technology in there, we're actually going in there with known quantities a lot of the time. And the fact that we've got proven collaboration outcomes with those known quantities is just making everything hum. So for me, it's collaboration. It is constantly talking, and I think everyone's being treated as an equal on the project, which is really good.
From a digital program perspective, I suppose at a slightly higher level, we've been connected across the building, the infrastructure team doing the build, but then also the hospital sort of transition team as well. So we've been three equal legs of the chair, the stool. So my reflections to date is that sort of cross-program collaboration is sort of one of the genuine jewels, and I look forward to it shining bright over the next couple of years. But that genuine sort of collaboration across all those different, I think traditionally maybe have been silos, whereas we're all one health system, so there's no opportunity or there's no allowance, or that's just not allowed, basically. I think it's probably the short answer. And really across all the users, and having the lab, I think, is probably one of those other jewels that will really shine bright, because we've got the builders are bringing all of their gear in as well to make sure that it fits and works. And we'll have the clinical staff coming in and using the patient queue management system to make sure it works for their particular clinic. And I think it's a really unique opportunity to actually get a mini version of the new building operational before it's commissioned, just to give people confidence. And that speed to commissioning as well. Historically, that's been a challenge for infrastructure, big, large infrastructures. And if we can get that down, the sooner you commission the sooner you have patients walk through the front door. And I've been setting goals for a long time, so before the word manifesting even entered the vocab, but it's that sort of notion of, if you set yourself on that goal, welcoming people through that front door for the first time, whether it's a digital front door leading to the physical front door, you can just, I think the teams, at the moment, the digital team's got some huge challenges. We've got a reorganisation that we're going through. We're trying to help the team focus on this as an outcome we're all working to. I think that's probably the thing that's going to help us get through Christmas.
Yeah.
But and then come back in the new year and just it'll be close enough that we don't have too much time, but enough time to get a really good job done. So I think that's what I'm really looking forward to in the coming months.
It's great. Nice, thank you. And Ray?
Well, we've also been manifesting this in New Zealand for quite a while. So I think some of our lessons learned, the patient experience. So even if patients enter a digital facility and choose not to engage with digital, they can still have the same amazing experience. So if I choose not to check in on a patient app or at a kiosk, I can still walk up to a counter, have that interpersonal connection, receive a ticket. and go and wait comfortably while I'm looking at the screen, sitting having a coffee. So I think that's what New Dunedin have done very well, supporting all patients. So that 20%, that covers the 100%. I like that. The other thing, and I know we've said the word collaboration a lot, but collaboration, not competition. We can't be all things to all people. So, we're not trying to solve the issue around wayfinding. We're working with, a wayfinding expert to help patients to find their way to their appointment and making sure something is suitable to scale.
Yeah.
So, that way other health services can leverage the existing investment rather than trying to reinvent the wheel and provide patients with a fragmented experience.
Yeah.
So, yeah.
I mean, it's been a great conversation with a group of collaborators making it happen, which is very on brand with Talking HealthTech. So I appreciate your time, all of you. And there'll be more information on the Talking HealthTech website from this episode, linked to the Five Faces profile on the website too. So, team, thanks so much for joining me on the conversation today.
Thank you. Thanks, Pete.